The basic suture that everything plays off of is simple interrupted. And once you know how to do that, you can learn how to do all the other sutures. And there's certain principles that are important that you use all the way through. And with the needle has a certain shape to it. It has that arc to it. And when you grab it with the needle driver, you get it about right there. So it's about a third of the way down in that range. You don't want to grab it here, and you don't want to grab it by the point, because if you grab it by the point, it'll dull it. So you always want to grab it right about here. And it's shaped, it has this certain arc to it because it's the general direction that your hand rotates, but also it's made so that when you put it in the skin and rotate it, it actually everts the skin edges. And the way it's made to be used is when it actually hits the skin, it goes in at 90 degrees. Because oftentimes you'll see people suturing like this, and it's not going to work properly. You want it to hit the skin at 90 degrees that way, which actually looks awkward, but all you do is penetrate through the skin, and then you tilt it around like that. And by doing that, it actually is going to evert the skin edge. And that's the proper way that the needle should go in. And if the needle's going in at a lower angle, like if it's going in this way, it's also going to create more trauma because you're cutting through a thicker portion of the skin. When you're going through at 90 degrees, it just penetrates through the skin, and then that's the shortest point going through, and it creates less trauma. And you go through this side, and then you can and it's always good to look at the point and see where you are, and then you can just feel your way through and come through the other portion of the skin. And when you do it, you try not to just have a small portion of the needle exposed, because then if you grab it, you're going to grab the point of the needle, and there's a good chance you're going to dull it after one or two times. So it's better if there's more of the needle penetrating so that you can grab it that way. And that's the basics of suturing. And any type of suture you do, that's the way it should be performed. And then when you pull the suture out, what I've found to work the best is you pull it through this way to get rid of the slack. And you go around the needle driver, you go around it twice, and you grab the short end and you pull it this way. And what I find works the best is you hold the short end and then you pull the long end towards you. And when you do that, it locks the knot. And there's different ways you can do it, but that way always works well to lock the knot. It's easy with braided suture, like Vicryl. When you're using Prolene, that's when it's much more slippery, and it's harder to lock it. And then you go around and you tie it like this, and then you come around, and each time you reverse the knot. And generally you're going to do at least 3 knots, but sometimes you're going to do 4 or 5, depending on the suture material. The type of forceps that I like to use is the brown Atzin, which has multiple teeth. And there's always the question of which do people like to use, the rat tooth, which is just the 3-tooth, or the brown Atzin. And even though these have more teeth, I find them to be actually less traumatic, because you don't have to, in order to manipulate the skin, you don't have to squeeze hard. You can just use these actually to push the skin around, because there's a tendency where somebody may take the skin and actually crush it and crush down on it. And when that's done, it creates trauma. With the rat tooth, you have to actually grab the skin more to be able to manipulate it, so you create more trauma. But with these, it's real easy just to use them to push them around. And when you suture, you should try not to do much manipulation of the skin. If you need to, you can push it a little bit just to find the proper position here, but you don't want to be grabbing the skin a lot, because every time that you create some trauma, that has to heal up. And in a case when you're putting in a simple interrupted stitch, to get to the other side here, you don't have to go and lift your skin up like this to put it in. You can actually just kind of feel your way through and go through like that. And the less trauma that you create with your instruments, the easier it is for the patients to heal up. How do you hold the needle driver? When you're grabbing the suture, you have your fingers in the rings because you can clamp down easy that way. But when you actually go to put the suture in, you take your fingers out of the rings and you should hold the needle driver this way, because when you have it this way in your hand, it's easy for you to get the actual needle at the 90-degree angle. If your fingers are in the rings, it's limited and it's harder for you to twist your arm. And in that case, what happens is you'll end up putting it in this way instead of getting it at 90. So that's why when you use the needle drivers, you take your fingers out of the ring, and then it's real easy for you to rotate it to do it like that. You don't want to hold it back here either. You want to hold your fingers close to the end of the end of the instrument, because you have better control that way. If you're holding it back here, you just don't have as good a control. You're going to be shaky. So you keep your finger up closer, and you go in, and you go in at 90 degrees, and then you bring it up so you see the needle, and then on the other side you want to be able to come in. You want to go as close to the same exact distance as you can get that you came on that side, and then you come through this way and you grab the needle. Don't grab by the point, grab the needle back here and pull it through, and then you do 2 turns around the instrument, grab the short end, pull it towards you, and then you'll pull the long end towards you, and that locks the knot. And when you do this, you don't want to pull it tight. You just want it, all we want is the actual incision, the edges of the incision to touch. We don't want that to be tight. There's a tendency that people pull it too tight this way, and then you get an overlap of the skin edges. Because all we want is the skin edges to just touch that way. And then we finish up by doing at least 3 knots, and that's going to depend on the type of suture material that we use. Sometimes we use more than 3 if it's slippery. If you're using something like a Proline, then you're better off putting a couple extra knots in, because Proline is more slippery.